Alright guys, welcome back. This is going to be part 3 of Pandemic Definitions 101. If you're joining me again, thank you for coming back. And if you're new here, maybe check out part 1 and part 2 and then consider subscribing if you find this valuable, because I'll be shooting another couple in this series. So the purpose of these videos is, and I have to say this at the top of every video, is not in any way to sensationalize information or instill panic or fear. In fact, it's the exact opposite. It's to arm the general population with actual knowledge about what do these terms mean that we hear constantly flying around in the media right now. And it always feels confusing or even more intimidating or frightening when you don't understand fully what these terms actually may mean. I know I did not understand the exact definition. I had a loose understanding of what these things mean. So I just think it's important to empower people with that information. That way they can adjust their risk assessment as they see fit. But it's easier to do that when you understand what they're saying, and especially as that, if that, kind of moves closer towards you, these are things you're going to want to understand. So that's the purpose of this, and we're just going to go through some pandemic definitions. And it's not respective to a pandemic. I mean, generally speaking, this would apply to any kind of infectious or contagious disease. So let's get into it. Just touch my face, which everyone says not to do, but I just washed my hands. Okay, so in this one, we're going to be looking at about, maybe 10 or 15 really quick definitions. So infection is the process of infecting or the state of being infected. Everybody knows what that means. Okay. Incubation in medicine, it is the moment, so from the moment someone is exposed to the moment that they begin to exhibit symptoms. However, with this particular coronavirus, COVID-19 situation, that is not necessarily true, because as you are all aware, there is the potential for asymptomatic transmission. So for my personal clarification, I would say that incubation is from when someone is infected with it until they no longer have it because it's passed through their system, or because they were diagnosed, treated, and came out successfully on the other side. So shedding, aka contagious, if you watched part 2, viral shedding refers to the expulsion and release of virus progeny following successful reproduction during a host cell infection. So in part 2, I talked about what a host is. And so shedding is just, basically it's the same thing as when you're contagious, right? So here it could be asymptomatic or symptomatic shedding. So that just means that you are infectious. You could potentially pass this virus on, this infection on to another person. Okay, so that brings me to symptomatic. Symptomatic is when you are actually exhibiting the signs and symptoms of this coronavirus, which seem to be high fever, dry cough, and a whole litany of other things depending on what part of the world you're looking in. So let's say, John has a 103-degree fever and he has a dry cough that is not productive. He is symptomatic. You can look at him and say, okay, this person may potentially have this situation going on. Asymptomatic is when you have someone who is carrying on as if there's nothing wrong because they don't know. So they are infected, but they are not aware of that because for whatever, their body is not producing outwardly, symptoms which can be recognized from someone outside of them or by themselves. So they're asymptomatic. They are not aware of infection. Okay, a carrier is a person or organism infected with an infectious disease agent but displays no symptoms. So typically speaking, we're talking about somebody who's asymptomatic. So, you have to feel so terrible for some of these people who were not even aware that they were ill, and, maybe they were a super spreader or a superior spreader or just spreading the infection in their local community and they just didn't know. So that, my heart breaks when I think of that situation, the guilt that a person would feel. Okay, exposure is the state of being exposed to contact with something. So if one person's going from, New York to LA, if two people are going from New York to LA on different planes and there's one person on a plane that has it, there's a level of exposure. Whereas if the other plane didn't have anybody with suspected or confirmed case, no exposure. Well, unless you think that it's circulating and that there are other people there that could have potentially given it to them. Okay, close contact, because we hear this a lot. Close contact is defined as persons within approximately 6 feet or 2 meters if you're across the pond, or within the room or care area of a confirmed or probable virus patient. Okay, so close contact. I'm holding your hand, kissing you. I'm in the same room with you. I'm arm to arm with you. Doesn't necessarily mean I have to kiss you. But let's say we're in the waiting room and we're arm to arm, or you're just one seat over, or at a movie theater, or whatever. Close contact. Okay? Now, monitored and self-monitored. So this is something that you see happening actually a lot over in, I believe it's the UK where they're doing this. And I think this is grand. I love this idea. But it's where instead of being physically monitored by a physician or a nurse, so if you're self-monitoring, right, you are taking your own temperature. And, maybe if you have a machine which can tell you the little finger thing, I think it's called a pulse oximeter or something like that. Put it in the comments below. I have one, but I don't know what it's called. Where you can put it on your finger and it tells you what your oxygen saturation level is. So you could monitor those kinds of things remotely, and then if there were a change, let's say, here's your baseline, and if it goes past this, the medical professionals want to know. So if you were self-monitoring, then that's what that would mean. And you can also be remotely monitored by a physician or some kind of medical staff. Or I suppose that the people that are self-quarantining, they're reporting to somebody. It's unclear to me at this time who that person is, but they are monitoring themselves. Okay? Unidentified. Those are people who either have it, know they have it, and have not reported to anyone, or have it, don't know they have it, and so as a result have been unidentified. So, you could have 100 people who they have it, they have no idea. They're not known to us, they're not known to the medical community, so they're unidentified. They're not suspected, they're not clinically diagnosed, and they certainly are not confirmed because they haven't been tested. So this is what this means, unidentified. Suspected means showing symptoms of infection but does not have clinical diagnosis. So, I look at somebody across the way and they're exhibiting behavior which I think is in line with the physical symptoms of the coronavirus, COVID-19. And I may say, oh, okay, well, I suspect that this person may need further evaluation. And so that's what that means. I suspect that they may require medical attention. So clinical diagnosis is different. That's the estimated identification of the disease underlying a patient's complaints based merely on signs, symptoms, and medical history of the patient rather than on laboratory examination or medical imaging. So that's like what's happening over in China, right? A lot of the times I think they were having to, and probably continue to have to, involve in clinical diagnosis simply because the influx of people on their medical system would make it impossible almost to test everyone or to do medical imaging on every single person. So at some point you're going to have to say, okay, the lines for clinical diagnosis are this, and if you believe that this individual has X, move them over here into a different area. So that is what clinical diagnosis means. It's based on observation of the patient and hearing what their symptomology is, maybe what their comorbidities are, and maybe where they've traveled recently would be a good one. Though as we go forward in time, that becomes less important as it is spreading across the globe. All right, and then tested, of course, means that there was an actual test involved, a test run. So a viral test is done to find infection-causing viruses, and the CDC has developed a new laboratory test kit for use in testing patient specimens for severe acute respiratory syndrome coronavirus SARS-CoV-2, which is the virus that causes COVID-19. The test kit is called RT-PCR Diagnostic Panel. It's a very long name and not interesting. But if you want to know what it is, it's novel coronavirus real-time reverse transcriptase. Okay, so that is the test that they are running, caveat, were running, before they had to pull all the kits back and say, hey, there's a problem, we need to go back to the drawing board. So hopefully those test kits will be coming soon. But that is what tested means. It means I didn't just look at you and suspect, I didn't bring you in and talk to you and make an assessment that it's very likely that you need to be tested. I actually tested you, okay? And then confirmed or diagnosed would mean that this test has come back with a positive result, indicating infection with the virus. So this is, as clear cut as you can get, I suppose, if you believe that the efficacy of this test is 100%, which of course even Tony Fauci said that this is not the case. So let's say that we're getting a clean reading, then that would mean, okay, this person has COVID-19, which is what you would call it at that point, because the disease caused by the SARS-CoV-2 is COVID-19. So that is what that would mean. All right, guys, well, that is going to bring us to the end of part 3. And I'm going to try to shoot, I think, 3 of these a day until I get through the definitions, because as this is evolving so rapidly, I think just having that information at your fingertips, if you hear a term and you're like, oh, let me go back and what did she say that meant? I think that's powerful. So I should have all of those done. So there'll be 3 today, 3 tomorrow, and 3 today after. And then I'll move into a different series, but still related to this. So I hope that information was not only helpful, but makes you feel empowered. This is kind of a scary time. If you're actually paying attention and you're hearing all of this, none of us have really ever lived through a worldwide pandemic of this magnitude if it becomes that. And if it does become that, I want to know, and I want you to know what all of this means. So, I'm always plan for the worst, hope for the best. And I'm sure that's what everybody else is doing. Thank you so much for spending time with me. I will see you in part 4. Bye, guys.